lives.
Is again in the midst of a medical dilemma for the second time in weeks. A mother has contacted our news team appealing for help with getting her 11-month-old child to a hospital with an available ventilator. She explains her child has been at the Maypen Hospital for almost 4 weeks. She says efforts are being made by the medical team, but hospitals appear to lack availability. And following an ongoing series of backlash, Health Minister Dr. Christopher Tufton is speaking out against claims made about his ministry's performance. Speaking on Lead Story yesterday, the minister specifically addressed the insufficient beds concern and has since denied the assertions.
I am saying that's not true.
And you're saying?
I am saying, however, because again I say, this is always a moving target.
Yes.
If you look at the health profile of the population a decade ago and compare that with today, the reality is that the demands on the system are far greater, which is why it's so difficult to compare in periods of decades, for example. People are dying younger, premature mortality because of lifestyle diseases. People are getting sick earlier. If you ask me if the health system is better off today than it was 8 years ago, I will say absolutely yes. And I'll challenge anyone who has an alternative view. I saw your guess. And sometimes people speak from a position of ignorance, because I heard some of the comments being made by the social commentator, which really is not factual. But we can get into that. So I do believe, based on what the government has spent, has committed to, I think some of the transformational changes that we have all hoped for, like digitization of patient records, the massive expansion of hospital build-out, whether it's Spanish Town, Western Child, or otherwise, which will lead to additional beds, additional operating theaters, and so on, that we are on a trajectory that we have never seen before. Now, are we there yet? I'm prepared to say not in all cases. Is there levels of dissatisfaction? Yes, but there are also significant levels of satisfaction.
In latest developments, the People's National Party PNP is calling for the Minister of Health to be removed amid growing frustration about the state of healthcare in Jamaica. The party claims the minister has not been considerate to the people's challenges and fear misappropriation of funds may be at play. Courtney Lewis has more.
Mandeville's Mayor Donovan Mitchell says Health Minister Dr. Christopher Tufton has been unconscionable and calls for removal of Tufton from the Ministry of Health. He was speaking at a PNP divisional conference in Spurtree, Manchester on Sunday.
But comrades, the only person can fire the board of political representative is the minister. So he needs to fire the board. And after he fires the board, Andrew needs to fire him because he's not doing what he ought to be doing. And comrade, he needs to go.
He was referring to the reports regarding the alleged poor state of the Mandeville Regional Hospital and says the South Regional Health Authority has not done justice to its healthcare workers. He adds maternal deaths have increased at the hospital.
In the region of Clarendon, Manchester and St. Elizabeth, we were having 23 maternal deaths. And let me explain to you. Maternal deaths is women who go into the hospital and develop complications and all of that, and they die. We had 23 of those persons between St. Elizabeth, Manchester, and Clarendon. In 2022, the figure says that we have 273. Why should we sleep and not hearing the cries of the women who have them died because we did not have the right equipment and the right things to save these women's lives?
Shawnee South MP caretaker and turncoat Paul Patmore continued the assault, suggesting the sector ails in part due to the misappropriation of public funds.
Because they were planning to come with a T-shirt at the 5,000 and they expect to get the amount of vote that they need to win the next election. So we have a duty to go there now and educate our people and make them know say because of the same 5,000 that's why the hospital is in the state that is in.
Patmore contends that the government has been too relaxed in addressing citizens' healthcare needs while trying to gain political capital. Courtney Lewis for CVM News.
Also in the news, day 4 of the Court of Appeal hearing regarding the tenure of Director of Public Prosecutions Paul Llewellyn is well underway. This morning, the opposition People's National Party's lawyer, King's Counsel Michael Hilton, doubled down on his argument that the government amended the Constitution last year only to extend the incumbent's tenure. Providing a chronology, he says, not only was the opposition denied the opportunity to review the bill before it was tabled in Parliament on July 25, but suggestions to make it effective on January 1, 2024 were allegedly dismissed. The latter, he argues, would have prevented Llewellyn from staying in office. Coupled with this, Hilton argues there was no move by the government prior to amending the law to identify a successor for the role. Now, our reporter Natalia Clark will have all the highlights from day 4 in our major news at 7. The body of 48-year-old Leroy Baker, also known as Public Eye, was found in 3 Chains, Mandeville, Manchester at about 6 Thursday morning. Reports are that bystanders stumbled upon the body on a roadway in 3 Chains close to the Caledonia Road intersection in Mandeville. According to Baker's relatives, he was last seen leaving his house on Wednesday at around 11 p.m. The police are awaiting the results of a post-mortem examination to ascertain the cause of his death. Mayor of Savlamar, alongside his colleagues in neighbouring parishes, are working towards an animal pound in light of an increase in vehicular collisions involving stray animals on major thoroughfares in Western Jamaica. The call is for farmers and animal owners to keep their animals tethered. More now from Courtney Lewis.
Stray cattle and animals often seen traversing the roadways are raising concerns for the Westmoreland municipality. The town's mayor, Councillor Danry Delancey, says the municipal corporation, along with the neighbouring mayor of St. James, are still procuring a functional animal pound.
We're doing some research currently as to do with the Animal Pound Act, as that's to do with the Keeping of Animals Act, and about 2 other related acts. So this is ongoing, and at the end of this, we will be meeting again to try and put something concrete into place.
Delancey, in speaking to our news team, earnestly pleaded with cattle owners to keep animals off the roads. His plea comes after an increase in cattle-related road traffic crashes in Western Jamaica.
You might be a farmer with a cow or 2, or goats, whatever, and you allow them to be tethered in a way that they can cause an accident along the roadway, or you're going to roam the roadway and they cause an accident involving, which could involve your very own family members or friends. So please keep animals off the road.
He further expressed condolences to the families of individuals who have died in the parish as a result of motor vehicle collisions involving these stray animals. Courtney Lewis for CVM News.
Thanks, Courtney. It's now time for a break, but there's more when we return.
I am death.
Ready, baby?
Ward off death. Obey the road code. A message from the Road Safety Unit in the Island Traffic Authority.
SuperMed family of pharmacies, your trusted partner in health and wellness for over 30 years, with 8 convenient pharmacies across Eastern Jamaica. SuperMed Mall Pharmacy, SuperMed New Kingston, SuperMed Pepine, SuperMed Port Antonio Pharmacies 1 and 2, Claire's St. Mary, Lloyd's St. Thomas, and a convenient drive-through at our Hughenden location where you can get your medication without leaving your car. We're dedicated to providing you with the highest level of care. Experience the difference with SuperMed family of pharmacies. Super happy, super healthy.
And you go down and have a good day. Blessing. SuperMed.
Our days get a little complex sometimes. Often so many things make sense, yet so many do not. We are being intentional about giving prominence to the big stories in order to clarify and enlighten. Lead Story explains who, what, when, where, why, and how. Lead Story with George Davis, weekdays at 6:30 p.m. on CVM TV.
Welcome back. It's now time for our discussion segment. Well, today we're talking healthcare, and there are some concerns around the availability of ventilators in Jamaica's healthcare system. Joining us now to shed further light on the matter is the opposition's General Secretary, Dr. Dayton Campbell. Welcome, Dr. Campbell.
Hi, good day. Thanks for having me.
Indeed. Well, doctor, you're a medical doctor, so we know you have more than just opinions on this matter. So what then is your view on the ongoing issue of what's taking place in the Ministry of Health regarding the ventilator shortages that we're seeing in some spaces?
Well, I think what is going on now is highlighting a deficit that exists within the healthcare system. And I believe that the approach being taken is not the correct one. The approach being taken is one that says that we have more than we did yesterday, and therefore there should be commendation without coordinating to ensure that you look at what the needs are and that you place the ventilators strategically across the country, and that you put programs in place to ensure that you have the staff trained to operate the ventilators. And when we comment on it, it's almost as if the minister is saying, well, because I have more ventilators today than I did a year ago, you have no right to criticize. Well, look at what took place at Nathan. A child died here, right? And yesterday we saw on a different newscast where another infant has been at the same facility for the last 3 weeks. In need of a ventilator, unable to get one at the facility and unable to be transferred. And so would have to be manually ventilated, meaning somebody would have to squeeze the bag for air to go in. That ties up a member of staff who has to be there physically doing that, who can contribute nothing else to what is going on the ward, regardless of what is taking place with the other infants or pediatric population. So that is not how we want the health sector to be run. So I think that there needs to be a reset in the health sector. And the population is growing, the needs are growing, and we have to be able to meet those needs.
Well, in terms of the claims that were made recently by the Chief Medical Officer regarding the numbers and how they vary daily and weekly, do you accept that? I mean, you're in the field.
What I think is taking place is a lot of verbal landscaping, beating around the bush. I think, based on what I heard from the CMO at the post-cabinet press conference, what she was saying is essentially how much space there is. It doesn't mean that you actually have that number of ventilators functioning. So, as I said, it's just verbal landscaping. It's a way of answering without actually answering the question. What the population wants to know is how many functioning ventilators do we have and where they're located. Additionally, come out and say, which is what the minister did a week ago, to say that there are 118 or 120 ventilators, which includes the numbers that are in the operating theaters, is disingenuous. because as you would imagine, we have 20-something hospitals in the country, with almost all of them having at least one operating room. In each operating room, you're going to have a ventilator, because when you put somebody to sleep, the machine has to breathe for them. That's what a ventilator is. It's a breathing machine. Now, in a hospital, say you were to go to St. Anthony Hospital, you have routine surgeries that we call elective surgeries, where somebody's there, they have a hernia, whatever other illness, they have a reschedule that surgery to take place. So the obstetric team may be using the theater on Monday, the orthopedic team on Tuesday, the general surgery team on Wednesday. That ventilator that is in the operating theater cannot be just taken out to deal with somebody who comes into the hospital suffering from pneumonia and is in need of a ventilator, because those are specifically for the operating theaters. So to give the country a report that includes the ventilators that are in the operating theaters is disingenuous.
What then would be the right approach to ascertaining the true number of ventilators in the public health system?
Right, so what I was expecting from the audit was for the audit to say we have 120. Of that, in St. Anthony, we have 5, 2 are in the operating theater, 1 is in the HD, and 2 are not functioning, or whatever it is. But that's how you would expect to have it. So that if a patient comes to me, I can know that, all right, at Falmouth there is 1 machine that is functioning.
Dr. Campbell, I'm so sorry. I missed you for a few seconds there. Could you just repeat what you said a little louder?
Right. I was saying that what I would want is for them to detail the number of machines that are available, the locations where they are, and for us to ensure that we have the staff in those locations to operate the machines.
Yes. Now, I want to take you back to Maypen. It's an unfortunate situation, but we have to go there because lives are at stake. And we are talking about another life, potentially that of another child, where we're hearing now from another parent almost similar allegations as to what would have transpired leading up to the previous situation. And we're also hearing that the child is stuck at this hospital. What would prevent the child from being moved to another facility?
And that is the crux of the matter. That is the concern that I am having, that the ministry is not responsive enough. So here you have a situation where a child died from, it almost seems like a mirror, right? It's a very similar situation 3 weeks ago. This child has been in the same facility for 3 weeks. This has caused public outrage, and the ministry has done nothing to either get a ventilator into the hospital to put that child on, or being able to move that child to a different facility. You'll recall that earlier they said that there was a ventilator at the hospital.
Yes, but it was not equipped for a child.
We have to question whether or not that is so. And the issue of the staff, when the minister comes out to say that a ventilator by itself doesn't solve the problem, I don't know who is lecturing, because that is his responsibility. It is the ministry's responsibility to ensure that you have proper programs in place to train the staff. We know that bigger countries are poaching on our healthcare workers. It was the same minister that told them a few years ago if they don't like what they do, they should leave. The minister has to put a proper program in place to train the necessary number of staff members to ensure that in the facilities we have the ventilators and we have somebody to operate them. I cannot accept that a child is in this position in the same facility where another one died, and we have done absolutely nothing to ensure that this one does not go down the same road. And to me, that is egregious, it's unacceptable, and somebody has to be held responsible for that.
All right. Well, thank you so much. That was People's National Party General Secretary, Dr. Dayton Campbell. We move now to international news. Israeli jets have bombed the southern Lebanese city of Nabathie, and this comes in the latest explosive exchange between the Israeli army and Hezbollah. The air raid targeted a building in the city center and damaged neighboring homes. At least 5 people were injured. With more, here's Al Jazeera.
Israeli warplanes targeted a building in southern Damascus, close to the area of Sayyidah Zainab. According to the Syrian reports, there are 2 civilians who were killed. Now, this is not the first time that Israel is targeting